of why they happen and what to do when they happen. So why they happen, they can be traumatic, which means that they happen in an instant, and it's one of those you fall on the steps or you're playing your sport and you get injured. Chronic is one of those ones that's long lasting. Your overuse is, I like to say overuse after underuse. So if you haven't been doing home workouts and you go and you do 7 days a week for 3 weeks after doing none for a couple of years, that's your overuse type injury. And then we have some muscle imbalances, which is a little bit more in depth, which can happen over time. So an example of a traumatic injury is when you're out on the field and you plant cut twist and you feel it pop in your knee, so like an ACL tear. An example of chronic would be low back pain that just never seems to go away. It's been there for years and you just can't seem to get rid of it. An overuse injury would be kind of like a quick onset of like a tricep tendonitis or Achilles tendonitis if you were to increase your running and you felt some pain down there. Muscle imbalances or muscle balance issues. Examples could be like a functional leg length difference. So if you feel like you're a little bit lopsided or something like that, that could be a common muscle imbalance. Common types of injuries that you may experience sports related would be like a runner's knee, golf, tennis, elbow, shin splints. Now that I've given you all these problems, how do you solve it? Treat it now. So if you treat your issue now, you can prevent more injuries. You can create an optimal environment for healing. So if you have this injury, you want to make sure that you are ahead of the game and don't let it sit and become this chronic issue. We want you to treat it now, so you can give us a call. We actually do evaluations on site and you don't need a referral for those. So come in, get your evaluation, and we can kind of take a look at you and see how we can get this optimal environment for healing and preventing other injuries.